Welcome to today's webinar. Oscar?
Hi, I'm Oscar Walters Duran with the John Burton Foundation for Children Without Homes, and on behalf of the webinar co-sponsors, the National Alliance to End Homelessness, the National Network for Youth, and the DC Alliance of Youth Advocates, I'd like to welcome you to It's a Data-Driven World, making the most of the 2013 Youth Homelessness Counts. I'd like to thank our presenters today. We can go to the next slide. Debbie Shore from the National Network for Youth in Washington, D.C., and she's also the Executive Director of the Sasha Bruce Youth Work in Washington, D.C. Lynne Morrison, the Policy Director for Ending Youth Family Homelessness at the Bill Wilson Center in San Jose, California. Maggie Ryden, the Executive Director of the D.C. Alliance of Youth Advocates in Washington, D.C. And today we're having Tyrone Thompson with the Las Vegas Clark County Continuum of Care. Next slide, please. Again, just to recognize the webinar sponsors, we're all working together to end youth homelessness and creating opportunities for homeless youth and helping them to reach their full potential. So thank you to all the webinar sponsors who worked hard over the last few months to put this webinar together. Next slide. So a couple of technical details. One, because there are so many folks on this webinar today, sometimes it's easier to hear if you call in rather than connect to your computer. So if you're having any trouble hearing the webinar today, please try to use the telephone versus the mic and speakers on your computer. If you have any questions or problems, you can click on the questions panel on your screen and type your question and click send. And just to let you know that the presentation materials and audio will be posted at several different websites, so you can access them later, the PowerPoint and the recording. We will have time at the end for questions, so we may not be able to answer your questions during the webinar, but do type them in, and we'll try to get to as many questions as we can. Great. So the purpose of today's webinar is to elevate awareness of the importance of the point-in-time youth counts in 2013, to encourage stakeholders to organize locally to make this count count, and to provide the tools, methodologies, and promising practices to support your efforts to get unaccompanied homeless youth accurately counted. So to do that, we are having an introduction by Debbie Shore, the chair of the National Network for Youth and ED of Sasha Bruce Youth Work, and she's going to kick off the webinar by providing a brief introduction to the new HEARTH Act requirements and why collaboration is important in order to obtain the most accurate youth count. Debbie will be followed by our three panelists, and we'll conclude with time for questions and provide a list of resources in our final slides. So Debbie, I want to turn it over to you.
Sure. And we are also thrilled, I am also thrilled, and I know that it has been a wonderful collaboration that we've had between the four agencies that are represented here. And I think that because of that community, we really represent quite a lot of the interests of the runaway and homeless youth programs in the country. I know that the runaway and homeless youth programs, which the National Network represents, need to be and should be very interested in this, because we really need to make sure that we utilize this opportunity with the point-in-time count in 2013 to get a real count of what the need is and the scope is of our young people that we care so much about. So the HEARTH Act essentially says that now that all subpopulations must be included in the point in time, including youth who are 18 to 24, of course also including youth who are under 18. But this year, there is a new category or a new way of looking at making an effort to get the numbers more accurate count, so that there will be a category not only of under 18-year-olds, but of 18 to 24-year-olds. And then, of course, 24 and up. And this also encourages communities to develop plans to end youth homelessness, of course, including young people. So why does this matter? We believe very strongly that accurate data will really help to support our ability to advocate for homeless youth in those places where counts have happened, and you'll hear about some of this, there has been a real impact on the ability to then advocate for scaling up of services. The lack of information about the scope of youth homelessness contributes to a lack of adequate resources in the many cases that we could point to as well. And of course, improved collaboration between youth providers and the continuums of care can lead to better delivery of services. And we certainly see the importance of having the count be the beginning of a much stronger collaboration between the youth providers and the continuums of care. We did a kind of representation, a visual representation of all of the stakeholders that really have to work together in order for the count to count. We need all the youth advocates, we need the programs, we need school coordinators, we need the public systems of care, continuums of care, adult providers who are serving 18 to 24-year-olds, and of course, we need young people and their voices who are homeless or at risk of homelessness. So this is our hope is that this is bringing together a number of the pieces that will help to make sure that we then organize to involve all of the stakeholders. Our aspirations are to help you, to help the communities that are out there plan for the youth component of the 2013 biannual point-in-time count. We can't underscore the importance of that enough. To develop concrete strategies to ensure the most accurate data, to learn techniques from your colleagues for better coordination of key stakeholders, and to discover creative ways of a plan for tackling youth homelessness in your community. And with that, I would like to introduce our first panelist, who is Lynne Morrison from the Bill Wilson Center, which is in San Jose, California. Lynne?
Thank you, Debbie. Next slide, please. So I'm going to start off looking at kind of looking at the big picture, providing an overview of the partners involved in doing the youth count and the role that each of these partners played in the count that we did. We have done a count, a targeted youth count, did in 2009 and also 2011, and are looking forward to 2013. So we're going to look at the partners. I want to look at the specific methodologies that we used and how we collected the data. And based on the methodology we used, looking at how we recruited, trained, and deployed the youth to do the counts, and then also look at the report findings and the lessons learned and plans for the next count. So first of all, the City of San Jose was a major player. They are the ones that funded the program. Can you go back to the San Jose? They're the largest city in the county of Santa Clara, so they primarily funded the point-in-time count, and they're the ones that really initiated doing the targeted youth count. With their in their Department of Housing homeless program, they take an active role in a number of different programs on the dealing with homeless issues, both adult and with the youth count. So because they were the primary funder, the youth count focused on the City of San Jose rather than the entire county, which is something that we want to look at going forward. Bill Wilson Center, which is where I work, is a community-based nonprofit agency that's serving families and youth, and we're the major or only provider actually of a continuum of services for youth in the county. So we have services from drop-in center to shelter, transitional housing, and up to permanent housing. So I think that gave us kind of the wherewithal to do this count. We had the staff that we could use. We had the youth that we could train to do the count, and we also had the site, which is important to be able to do the trainings and also to deploy the youth. So there was two separate types of the count. So there was also the shelter count, which is just done by for all of the homeless populations, and so our transitional housing programs and crisis youth shelter did that particular count, and then we used the drop-in center to do the street count. Next slide. Applied Survey Research is the contract agency that the county has contracted with to do the larger count and also the targeted youth count. So they come with a level of expertise of doing this count in other areas, specific targeted youth counts and also the larger counts. So they're the ones that helped us with providing the methodology, the training, and then also the analysis of the data. So they were a very important partner in this. Next. And then there's also the Santa Clara Collaborative on affordable housing and homeless issues, which is the continuum of care in Santa Clara County, and it includes all of the players providing services to the homeless population. And we've been a part of the collaborative for a number of years. We serve on the steering committee and also have been part of many of the working groups within the collaborative. And so for us, and I know this is different with a number of entities around the country. Many are not involved with the collaborative. For us, that we were already there, so that was a huge piece that we didn't have to tackle because it was already happening. Next. So the methodology, like I said, there were two different focuses of the count. There's the shelter count and then there's the street count. And the shelter count included our youth shelter and our transition age youth, transitional housing, and our TAY shelter also. And those numbers were reported on a single night, which was the same as the adult shelter. So that was incorporated into the larger count, and that's a number that we've been doing for a number of years. So that was just implemented again in this particular count. The one that was, I think, probably the most important, though, is targeting the street count, which was the targeting youth specifically in the street count. And for that, we use the drop-in center staff and youth. We have anywhere from like 35 to 40 to 50 youth a day that come into our drop-in center, and so it was really it was helpful for us to be able to utilize them as the experts to train and to do the counts. The count itself, the targeted street count, was done over 2 days between the hours of 3 p.m. and 7 p.m. And there's a number of different ideas on when the count should be done. Some people do it later in the evening. This was one that we determined for our area was effective. For any youth, the unaccompanied minors that were in school, they would be out of school at that point and therefore be more visible. And for youth living on the streets, again, that was a time when they were more visible and we could get a better count. So that's why we chose the 3 p.m. to 7 p.m. Like I said, others have done everything up until midnight, and it just depends on the area and what makes sense. Next. So in addition, can I have the next slide, please? So in addition to the street count, which gives you bare numbers, which is important, we also administered a survey, which gave us an opportunity to ask different questions. There's a survey that was developed for the entire count, and then in addition to that, there were other questions that were specifically focused on homeless youth and their situation. So that's kind of an area where you can, again, tailor it to what information you want to gather from the count. And there's a couple of ways of doing that with the youth, which is you can do it as you're doing the count every third youth encountered. You can do administer the survey then, or administer it on subsequent days after the count. And the other piece is making sure that there was a representative sample of sheltered youth in addition to the youth that we were counting in the street. Next. So based on our methodology, which was acknowledging that the best way to do the count was using homeless youth as the experts in identifying and counting the youth, then we developed a way of recruiting those youth and training those youth. So like I said, the youth came from our drop-in center, and the initial step was to identify leaders of the youth in the drop-in center, and these were youth that were taking a really active role in participating in our drop-in center services. And with those youth, we held a number of focus groups that gave us the information on the specific areas we should focus on to do the count, and also identifying youth that were familiar with those areas, so they would be able to really capture the numbers in a better way than we could. And then also it's important to get a commitment from the youth to participate and to recognize that there's a number of youth that will want to participate, and that number is going to be smaller in terms of the numbers who are actually able to commit to it and to follow through with everything that you needed to do. We actually had, I think at the end when we did our count, there were 8 youth that participated fully in it. So. And then the next step after finding out all the information and gathering the youth is we have those youth go through a training with applied survey research. So there's like a 90-minute orientation about safety and about how to do it and where to go and all of those types of things. And then specifically, how do you fill out the enumeration forms and how do you administer the survey, so that all of the youth are trained on these various aspects before they go out. Next. Then there's the deploying. What we did is we had the youth go out in teams of 2 to the specific areas that they had identified, and we had staff that drove the youth out to those places wherever they had identified. And another, I think, important piece of it is that when they reached those sites, the youth were the ones that stepped out and were visible, and the staff hung back, because I think that can also create some problems if there's a number of staff that are walking around with the youth. So that seemed to work for us, to have the youth actually stepping out there, the staff staying in the background. And at that point they were looking at categorizing youth as being under age 18 or between the ages of 18 and 24 and getting distinct counts on that. I think another big piece, obviously, is that the youth were compensated for all the hours they worked. They were paid an hourly wage that was paid to them at the end of this whole process. And we also, provided meals, because that always helps with getting people to come to the table. And this same methodology, we use the same methodology over the 2 days, just moving from site to site and providing the same type of enumeration. Next. So in addition to the numbers that we got out of this, there were a number of other report findings that we got through administering the surveys. And those are all, you can look at the, at the various findings and stuff like that at the 2011 City of San Jose Homeless Census and Survey. But it gave us some ideas on who these youth are, so you can get some of the demographics. Where are they typically residing at night, which can give good information in terms of programs and how you want to target the different youth. And also, are they using government services? What are they? Where are the barriers there? Social support networks. What caused the homeless episode? So any number of different types of information that can be really helpful in terms of tailoring specific information to specific programs. Next. So the goals for our future count is to expand the count to include all of the county. At this point, like I said, we did the City of San Jose, which is a very urban, kind of somewhat compact area. We were able to identify specific sites there. And looking at the larger county, we are a combination of rural and urban areas, and we recognize that there's going to be challenges in counting the more rural areas, and we're working on trying to identify what those are and who can address those. The next step also is to engage the homeless liaisons in the school. The school districts all have a McKinney-Vento liaison that's responsible for identifying homeless youth, homeless families in the school and providing services. So, and then the next step also is to utilize this data in ending youth and family homelessness, which is the goal that we're all working towards. So if we can accurately count the numbers and look at the different characteristics, then we can definitely focus our attention on areas that we know can be successful and bring more funds into the area to provide those services. One of the things that we've already started doing is we've already started meeting with various stakeholders in the county and the city and the school to try and start looking at what are the challenges right now so we can start planning for that. We're going to meet with the school liaisons at their quarterly meeting and work more on that and try to find out how we can incorporate the data they have into the data that we need in order to get an accurate count. Next. So I would say that the lessons learned on doing this count is it's really, really important, obviously, to involve the youth from the beginning in the planning and the implementing. They know where the youth are. They're the experts on this, and they provided a lot of guidance to us on where we should target our energy. I think without that, we would have just been, kind of wandering around and trying to hope we were getting the right places. So the youth were really, really valuable, and I think that in order to get their commitment, I think it's important to recognize their importance, and one way of doing that is to make sure that they're paid for their time. So like I said, we paid them, $10 an hour over every hour they worked, whether it was the training, it was the enumeration, and then when they were doing the surveys, it was a little different. They were paid per survey accomplished, but it's important to acknowledge how important they are and to pay them accordingly, I think. And then the other lesson is really, I think that this is a good methodology that we've used and it's been effective in our area, but there's also limitations to it because it's not, I don't think it's going to work as well in our rural areas, and so far we haven't been able to take into account the school data. So we are really, I think, looking forward to taking the information that we've gotten in the last two counts, really expanding on that and really trying to engage other partners in moving forward and having an even better count in 2013. So thank you very much.
Hi, everyone. This is Maggie. I'm here to actually shift gears just a little bit and talk in some depth about how some of the lessons the district has learned in coordinating and collaborating closely with our Continuum of Care and our interagency council generally. Really the goals here, like I said, are how we've evolved to have a close working relationship with those entities, the outcomes we've realized through that engagement, and how we got there, the strategies and approaches we utilized, and our goals looking ahead. I would add that my organization, the DC Alliance of Youth Advocates, did do an independent homeless youth survey in 2011. It provided us with an incredibly deep amount of information. We are not as great in the district at integrating with our larger point-in-time count, so it's been really interesting going through this process to hear how other communities have done that successfully. So next slide. So at the onset in 2010, when we sort of stepped in and realized this was a key priority, we had 3-4 really different entities all focused on homelessness here in the district. We had youth providers, 3 which were primary and the major providers of services to that population, who although they were collaborating, it wasn't as close or as intertwined as we perhaps wanted to see. And really the motivation to come together and partner more closely was born of those providers, Sasha Bruce Youth Works, Covenant House of Washington, and the Latin American Youth Center. We then had the Interagency Council and the larger Continuum of Care, which was much more closely integrated with providers working and advocates working around family issues, and providers and advocates looking more closely at individuals. Next. Sorry, go back one. Today, we really have a truly integrated system. Oh, back once more. Where the youth providers have a solid seat at the table within the Interagency Council on Homelessness here in the district, where we're speaking collectively as a group of advocates, providers, and consumers across the board, families to individuals and youth. And we're able to truly influence on the front end the continuum of care, the services provided, and the funding. What does that mean in reality? Next slide. Can you click? There we go. So stepping back again, starting in 2010, we had about 122 beds for youth in the district. Under $1 million in local funding was allocated to that population. And in our point in time, at that point, less than 10 young people had been counted who were under 18, although we did know that roughly 600 families with a head of household under 24 were included in that count. By 2011, if we can go to the next little animation, we were up to 156 beds, well over $1 million in funding. Our capacity to count accurately young people within our point in time was improving. And then we, at the same time, DCAYA, working with community partners and recognizing that we weren't at a point where we were capturing this population effectively within a point in time, executed our own survey where we identified and interviewed 390 homeless youth over 2 weeks in March, and were able to pull just a really deep and robust amount of information from that sample around the composition, demographics, needs, services utilized of that population here in DC. That was key and really leads us to where we're at today. We can get the next slide. Yeah, there we go. Where we have over 230 beds dedicated to youth. All told, that represents something close to a 56% increase in our continuum of services. We're well over the $2 million mark and close to 3, if not just over now, in terms of local funding. Unfortunately, as you'll see, once again, our capacity to really integrate youth into our point in time is still somewhat limited. We anticipate that changing this year, in part because the composition of families within the district shelter system headed by individuals aged 24 or under has increased significantly. They now represent about 1/3 of shelter users. With that has come a real recognition across the board that we need to be more thoughtful in how we're looking at engaging and counting young people in the district during that key point in time. At the same time, we've also, as a result of this process and going through, been able to appoint 4 youth providers or advocates to our interagency council, meaning that there truly is a robust youth voice at the table. And we've ensured that there's increasing awareness of other participating stakeholders within the Department of Human Services, within Department of Mental Health, police, around the true size and scope of homeless youth population in DC. Next slide. So how we did it. First lesson learned was having linkages and a coalition of willing partners from within the youth provider network. Their ability to come together, identify a clear need, and speak collectively was huge. Second, we came in and did some research. We knew to the best extent possible we wanted to know how many had been counted in prior years and be able to compare this to what youth providers were seeing on the ground to really make the case around need to better understand this population. Knowing what your waitlist or turnaway data is really increases the argument for a more intentional approach to youth and opens the window of opportunity when meeting with a continuum of care to apply your expertise as youth providers. And doing so can really help achieve a more accurate count down the line. At least that's our hope. Further, we knew the funding and service breakdown. That was really important for us as well, as being able to articulate this is the need, this is the current investment, there's a clear disconnect. Next up, once we got that seat at the table, we had our research, we were speaking collectively, we had to be solution-oriented. For us, that meant not just coming in and expecting that our ICH or our continuum, larger continuum, would do a lot of this work. They simply didn't have the expertise or necessarily the capacity. Our youth providers and the young people they worked with did. That was huge. It allowed us to engage, and coming with solutions, thoughtful recommendations, allowed us to really engage and educate other providers and potential partners around the unique needs of young people and be able to provide some very concrete recommendations on how we can push this issue forward and obtain better information. Next up. Within that, we became a constant presence at every community meeting focused on homelessness or with the ICH. Providers were there, young people were there. We covered the steering committee or subset committee meetings of our interagency council. We were at every quarterly meeting. Basically, we became a bug in their ear they could not ignore. That was critical to ensuring an increase in investment. We also, through that process, were really able, as I said, to come together and with the family providers or advocates, with those who are working on individuals or the chronically homeless, and speak collectively. They understood more accurately how youth were different, and there was a willingness to work with us to prevent further homelessness by investing on the front end and better supporting our youth and young adults. Next slide. So looking ahead and building on this success, we're really hoping this year to support the capacity of our local point in time to apply some of the strategies you've already heard about and will continue to hear about to make sure that youth are truly integrated and we're able to achieve a more robust sense of that population. We're going to continue to support the ongoing collaboration both within our youth provider network but also connected to our partner allies and our larger continuum and the appropriate government agencies who are supporting this work or have a vested interest and responsibility. Finally, we're going to continue to use this information that we captured both in the study that we're able to obtain through this year's point in time and through collaboration with our ICH to develop a true robust youth plan. What I think our biggest takeaway through all of this has been is that increasingly our partners are incredibly aware of just how unique our young people are, but also the opportunity that they present. And that if we have a thoughtful, coordinated plan that looks at both prevention and diversion from homelessness or unstable housing through reconnecting our young people, that's how we're going to achieve the longest and most substantial outcomes for this really incredible, resilient population. If you're looking for more information, particularly on the model and methodology we used in executing our study, I'd encourage you to visit our website. You can find the report there, and feel free to reach out to me as well. I'm happy to talk about it in further detail. Thanks.
All right. Good morning to some and good afternoon to others. My name is Tyrone Thompson. I'm the Regional Initiatives Coordinator in Southern Nevada, which is also Las Vegas. I also want to announce that Michelle Fuller-Hallauer, she's our Continuum of Care Coordinator. She assisted with this presentation. Want to thank Lynne and Maggie for doing an awesome job. A lot of the things that I'll mention will be repeated, but that's good because that reinforces that those are good tips and tools for your communities, we feel. Just to give you a little background about Clark County, the first slide, we talk about the continuum of care and the relationship with our school district. Our school district is called the Clark County School District, and we are the 5th largest school district in the United States. We have over 300,000 students. So in our county of about 2.2 million, we only have one school district. With that, we work with our Title I Hope Coordinator, which again, through the McKinney-Vento, at the school district, this person sits on our Committee on Homelessness, which is our decision-making body. What we have on the makeup of our Committee on Homelessness are all of our jurisdictions, all of our cities. We have our Metropolitan Police Department. We have our school district, Veteran Services, and some of our homeless service providers that sit on this board, and they meet monthly, and they are our decision-making body. We have a Title I Hope Project facilitator, and they work with our Continuum of Care Evaluation Working Group on a monthly basis. And we also have, as a part of our Continuum of Care, we have a Homeless Youth Services Working Group. Next slide, please. With the office, we have a really good rapport, so we don't just kind of wait, you know, when the census comes around. We're working with them almost weekly, and so on monthly, they give an update on the housing status for the youth in the school, as we have various liaisons in the various schools, and they give us updates on the housing status, which it breaks it down into those youth and children that are attending school that are living in hotel and motels, literally living on the street, living in a caravan or camper, emergency shelters, or doubling up with other families. And when we conduct our point in time, we actually get that information from the school district. We also work with our youth drop-in shelters like very similar to how Lynn discussed with the Bill Wilson Center. Next slide. With our training, we have our youth teams, our youth census teams, and these are not only just our former and current homeless youth, but also with our homeless service providers. A lot of times we'll have some of our recreation leaders in our recreation centers, and of course we have a lot of our we have a large faith-based community in Las Vegas, and they're actively engaged in our business partners. When we first did our count, we did our count in 2007, and that count was separate from the overall Continuum of Care count, and it was held at nighttime. And so, of course, most of the areas that we looked at, we were actually looking at the rooftops. You know, you count the rooftops because in our community, I'm sure it's no different than others, that's where a lot of our homeless youth will sleep because it's they're less likely to be seen. But then now we've changed it in 2009 and 2011, where we actually do the point-in-time count during the day. So we conduct it from 11 a.m. to approximately 3 to 4 p.m. in the afternoon, and the targeted areas are the malls, the parks, the recreation centers, and definitely the fast food restaurants. Next slide. We wanted to show you this slide because Southern Nevada is a vast area, and we really look to cover all of our areas. We look at all of our census tracts. We are 7,900 square miles of space, and so in order to cover this area, and especially with the rural areas, we use our code enforcement, our animal control, our police department. They actually have helicopters. Our recreation centers, our family resource centers, and of course our family, our homeless service providers. Next slide. And again, our process, even though on here it looks simple, but of course, as we know, there's a lot of steps involved with this. We use our census tract maps that we do through our GIS, and we have many coordination and team meetings. We give out the assignments. We have deployment centers. So it's not because of our big areas. We have different areas, and the jurisdictions actually will serve as leads to those deployment centers. We'll send out our volunteers, and then we do our report back. You can go to helphopehome.org. Again, helphopehome.org. That's the website that talks about all of our homeless services coordination. It has our over 100-page 2011 census, and there's a few pages that talk specifically about our youth census. And we will be changing up in 2013. Our actual point-in-time count is conducted in collaboration throughout the whole state. So we will be doing the urban core areas on January 24th of 2013, and we do the rural areas on January 25th. We're going to be working closely with our HMIS administrator, again looking at some cost savings and also really looking at the data. And so we're really excited about this new effort of working with our HMIS administrator and doing all the data analysis and doing the further reporting. So the next slide, and the information to contact Michelle, again, who is our Continuum of Care coordinator, is listed here. So again, thank you again for your time.
Good afternoon, everyone. My name is Samantha Batko. I'm with the National Alliance to End Homelessness. I'm a program policy analyst here. I will be conducting our question and answer session for this afternoon. And first, I would like to take the opportunity to thank all of our fantastic panelists today. We've collected a number of questions over the 3 different presentations. So I'm actually just going to go through in order. So I'm going to start with directing questions to Lynn, and then I'll move on to Maggie and Tyrone as we get a little bit farther into the questions.
Our first question, and I'd also like to remind listeners that if you would like to submit a question, again, you use the dashboard on the right-hand side of your screen and send questions to us that way, and we'll ask them out loud to the speakers. So the first question is for Lynne. Like I said, you stated that you did your street count on 2 nights from 3 to 7 p.m., I believe it was. We got a lot of questions from people saying that their understanding is the count is supposed to be on a single day, and how was it accepted since it was spread out over 2 days?
Yeah, it was, and actually with our county, the point-in-time count that we do for the general population, since we're so large, it's done over 2 days. So the shelter count was a single day, and we took all the information from all of the shelters in the county, youth and adult shelters and transitional housing. That was a single day, and then the count itself was done over 2 days for both, like I said, for the regular count and for the youth count, and that was an acceptable process.
And to tack on to that, Lynne, how do you prevent getting double counting youth?
Well, part of it is the youth themselves doing the count. It's going to different areas, so we're not doing repeat areas and finding different sites. And we're finding that youth, youth don't travel around the city that much necessarily. They really do stick to the sites that they're comfortable with. So there was really no, I don't think, conscious methodology that would pick out that it wouldn't be duplicated. But we tried to do the youth in the shelters, and we did the youth in the afternoon, knowing that those would be when the youth would be out of school and be more accessible.
Thank you, Lynne. Tyrone, I also just wanted to tack that question onto you as well, since you mentioned that you do your urban count on one day and your rural count on another day. How are you avoiding duplication?
Again, a lot like Lynne stated, really trying to do a hit and miss, a lot being that we do have the youth and of course the current and formerly homeless youth, and we kind of use them as those guides and those experts. So that's, pretty much, how we try to minimize duplication.
Okay,
this is
great.
Maggie. If I could hop on for a quick second on that question, because our study was done over 2 weeks, and although it wasn't a part and parcel to the point in time, what the strategy that we used, recognizing the potential for replication was pretty high, was a unique identifier that's been applied in a couple of communities, which is first and last initial combined with month and year of birth. It's a pretty accepted method across social science research that both maintains confidentiality but also diminishes the potential for replication.
Great. Thank you so much for jumping in on that, Maggie. Lynne, one more question specifically about your methodology and your specific surveys. Where did you receive the funds in order to pay the youth?
We received that was part of the contract that the City of San Jose negotiated with the contract agency, Applied Survey Research, and Applied Survey Research paid the youth.
Great, thank you. So this question I'd actually like to open up to all three of you, but sort of in different contexts. You all mentioned that you worked with local school districts and your local school liaisons, or that you're trying to work with your local school liaisons to get better information. And we've gotten lots of questions about sort of the mechanics of how that works, and then also how you're specifically targeting the different age brackets. So the first question I want to ask is that you, a couple of you mentioned working with your local public school systems, but when it comes to 18 to 24-year-olds, they're probably minimally involved in high schools. Are any of you working with local colleges or institutions like community colleges that might be working with an older subset of youth, the 18 to 24 population specifically?
This is Maggie. We in doing both our study but also looking ahead at the work we're doing, we've been very intentional about folding in either the Department of Employment Services and their one-stop or adult training programs and opportunities. A lot of outreach has been done and will continue to be done with GED programs in the district. Given our graduation rate, we recognize that's a pool of likely of a higher potential to have homeless youth within. And to some extent, the local community college and the University of the District of Columbia. But really for us, the targets that have been the most effective have been the job training centers, post-secondary ed credentialing groups, or GED providers. And they really understand the nexus between homelessness and employment and education and employability and sustaining housing, and have been really powerful allies across the board in the work that we've done.
And just to add on to Maggie, this is Tyrone. We also are strengthening that relationship with our Workforce Investment Board, and they also see that importance. With the reports that we get from the school district, they actually break the data down by elementary school, middle school, and high school. And we also, on our Committee on Homelessness, our overall policy-driven board, we have representation from the University of Nevada, Las Vegas, and also from our College of Southern Nevada. And so we're really working to engage them better than we have in the past.
Okay, great. So as we started to talk about this, we started to get a lot of questions about, very specific questions about this school's data information. So I'm going to ask them, if you don't know the answer, that's perfectly okay. We can try to find out the answers and follow up with the people who are asking them. But Tyrone, this one is specifically directed to you. You mentioned that you are collecting the information from your school liaisons, and then you have a breakout of the data based on housing status categories. Are your How are you getting that data? Are your Title I staff directly inputting that information into your HMIS, or are you just getting a completely different breakout of that information?
We get a completely different report.
Okay.
So they aren't directly inputting that information into HMIS. We just get the monthly report. But again, we're still trying. Of course, there's the still trying to work on the confidentiality, which is a big piece of that, and with them sharing that in the HMIS. But we do get reports, and again, like Maggie mentioned, there's certain identifiers, so it's not specifically giving names of students, but just some unique identifiers.
Great. So that's actually one of the other questions that people had asked, is how, and maybe you all could talk to this if you're doing it different ways, but how are you preventing duplication between the school system and your street count? I mean, you obviously mentioned the one particular unique identifier. Are there any other strategies that people can use?
Well, I think, this is Lynn, when we're looking forward, we haven't done the school count yet, but I think when we incorporate that, it's going to mean changing the time of day that we do the street count. So it sounds like what, Tyrone, they did theirs during the day. Well, if you're doing yours during the day when the youth are in school, then you wouldn't be counting those youth. So I'm thinking that would be the direction we're going to need to go in if we're incorporating some of the school data in.
Okay, great. Thank you. So, Tyrone, this question goes specifically to you again. I've gotten a number of variations of this question, and so could you highlight how you've developed the relationship between the COC and school system? A lot of what we're hearing is that the school liaisons in our districts are so stretched thin. They don't have the capacity to do this. How have you formed that relationship? What sort of incentives, if you have any, or how have you persuaded them to participate in this count effort?
Well, actually, we have what we call the Southern Nevada Regional Planning Coalition, and this coalition was developed over 10 years ago, and it was basically established with all the jurisdictions, including the school district. They were a key partner at the beginning. And it was mainly to work on infrastructure needs, planning needs. As most of you know, Las Vegas, I mean, we had just a growth boom over the last 10 years or so. And so we already had that committee established, and as we started moving forward with things, they saw that homelessness was a huge issue. It wasn't any certain cities like the city of Las Vegas or North Las Vegas, Henderson's issue. And so it just kind of naturally fell into place, so to speak. But again, we also as staff, we have to continue to build those relationships with the school district. We have a new school superintendent. He's been on board for maybe 2 years. We've created great rapport with him, and so it just kind of, everything kind of meshed into place. But again, you have to continue to nurture those relationships, and that's, I think, what is the key to that.
This is Maggie, and I would absolutely echo that. I mean, for us, having the Interagency Council on Homelessness for the district, which does have a youth subcommittee, has been a huge way to sort of mandate and engage and initiate that relationship building, but it takes a lot of care and feeding as you move forward. But it's allowed us to both connect more closely with DC Public Schools as well as the Office of the State Superintendent, which oversees our charter schools, which is a pretty big bucket here in the district. So being able to start there and really creating a give and take has been helpful.
If I may add also, we have what we call through the Southern Nevada Regional Planning Coalition, we have a committee on youth. And this committee on youth, like the Committee on Homelessness, they're a policy-driven board, and they actually are looking at cradle to career. And one of the philosophies is the Ready for Life initiative. Most of you might know about that. That's the Ready by 25 evidence-based initiative, basically stating that if our youth 14 to 24 are not, if they don't have their education, meaning their high school diploma, and or that connection to the workforce, then most likely they're going to be involved in our juvenile justice system, our law enforcement systems, and definitely our social service systems. So the community, we're all getting it, and we understand that, you know, instead of working apart from each other, we really need to work closely together. So that's actually helped as well.
Lynn, I want to go back to your survey in particular. We've gotten a couple of questions with people asking about some of the logistics of how you use youth volunteers. And the first one is with respect to the compensation. You mentioned that you had to move from hourly for the compensation to the enumeration per survey. So how do you eliminate the potential for fraudulent surveys, which is incentivized by sort of compensation per survey completed?
That's a really good question, and I think some of it is looking at the surveys, and a lot of that was done by applied survey research and crunching the numbers and what they look like, and being able to apply certain codes and categories to it to look at whether things were being duplicated and whether they were consistent with what they should look like, that type of thing. And frankly, there's no hard and fast way of doing that. So we kind of do the best we can in looking at the surveys and looking what's coming back and recognizing if everything looks exactly the same. So it's not I don't think it's a hard and fast science, and a lot of it is how when they're doing the kind of data crunching, looking at some of the trends and what that looks like. But that is definitely an issue, and I don't know that there's like I said, you can come up with a hard and fast, it doesn't happen at all. But based on the outcomes that we got and the reports that we got, it seemed like it was consistent with what we know about the population. So I think that's kind of the best murky answer I can give.
Okay. Great. And so the other question that we had in regards to this was, and Lynn, I've seen you present a number of times on this at our conference and on webinars for us before, is that you often talk about the great importance and the huge value that having youth counters and having youth actually performing the street count with you does. We've gotten a couple of questions about sort of like the safety, like how are you ensuring the safety of the youth volunteers in doing some of this outreach type behavior and sort of the out in the streets, like in the alleys, going into buildings, like how are you actually ensuring the safety of these youth at the same time?
Well, part of it is training the youth up front. So training them in not necessarily, you know, in safety types of issues, just like you would train your outreach workers in safety issues of not approaching people if you feel unsafe, to get out of the situation. And we also have staff that accompany the youth, so they're never out of sight of the staff. The staff may not be right up there with them, obviously, but they're never out of sight of the staff. So I think it's a combination of training and making sure that you're also choosing youth that are accepting the training and understanding their role and how they can get out of a situation. And then it's also the staff supervision to kind of make sure that situations are safe for them.
And if I may add, when we did our count in 2007, where it was at nighttime, of course we always let law enforcement know, and we it's not like they're flooding their calls, their cars in the communities and stuff, but we make sure that, you know, they know that we're doing the count, and we usually will have some type of bright badge identifier so they know what's going on, and then just to kind of have some of that presence, but we don't want to overload it because we don't want to shy away the homeless youth either. So trying to make that equal balance, and then again we'll usually have van teams where we have some adults, and then they will drop off our teams in certain track areas, and they'll say, okay, we'll meet back up in an hour or so. So it's pretty a pretty good control, but also allowing those youth teams to do what they need to do.
Okay, great, thank you. So Tyrone, I want to turn to you and ask you a couple of questions between the difference between doing the urban count and the rural count. So San Jose, DC, Las Vegas, all very urban areas, and a lot of the people who are on our webinar today are asking, how is this different for a rural area that, one, may not have the resources that you have in order to do counts, and also sort of like youth homelessness might look differently in those areas. Can you speak a little bit specifically to the rural aspect of your count?
Well, it's going to be new for the youth part, the youth component in 2013. But when we've done it with the overall census count, again, like I was saying, we really use and to really, you know, make it safe, because it's a lot of the outskirt areas. We use law enforcement, we use our code enforcement, animal control, and again, we try to identify, we do our planning ahead of time with the census tracts. So we will know pretty much, have a cursory idea of the populations in those more rural areas, and then we just kind of devise our plans from there. It's really, I don't think it's a correct way to do it, but we try to do it. We tweak it every single time that we do it. So again, this will be the first time we're pretty much doing it with the youth count in 2013, really stretching out to those rural communities.
This is Maggie, and although DC is clearly not rural, one thing I would say has been helpful to us and what I've seen utilized elsewhere is, if possible, looking at either a local college, community college, university, and by local it can be a ways out, or the faith-based community. They've been really active partners and supporters throughout. So thinking a little bit creatively about what you need in resources, and if it's a question of manpower, really stretching and thinking about different pockets of the community that could be interested in supporting the work.
Okay, great. Lynne, I want to jump back to you quickly. This is a follow-up question to one of the questions that we just had. You stressed the importance of training your youth that are going to be your volunteers in doing the street count. And as soon as you mentioned that, everyone asked, is there presentations or training materials that you're using that you could share with the audience that they could use to train youth for their own counts? And do you have those available on your website? Would you be willing to share them and we could post them on our website?
I would like to say we do, but we don't. We're not that organized to have something like that. I'm thinking that probably the best source at this point would probably be through the applied survey research. And I'm not sure if they have the specific trainings, but they've done the trainings all over the place with a number of different organizations. So I don't have anything specific to the count that I can share at this point.
Okay, so to everyone on the call who just asked that question, we will follow up with ASR separately, and if we can get those materials posted on our website, we will do so and let you know through our newsletter. Okay, going back to some of the questions, we've got a lot of questions about doubled up and doubled up youth and through a couple of different venues. The first is that since this count is happening in the winter time, there is a fear that you won't get an accurate picture of how many homeless youth you have because they will not be on the streets, particularly in cold weather environments. And I was thinking, Maggie, perhaps you could speak a little bit about to this in DC because you're actually the coldest climate that we have on the call today, and to if DC had concerns about this, obviously your count was done at a different time, but how you would mitigate this, and then we can talk a little bit more about the doubled up issue separately.
It's a great question, and I wish I had a silver bullet, but I'd be lying if I said I did. It was exactly that challenge that led us to do the study in March, and actually if I were to do it again, I would push it even further into the spring, just because we know that young people are really tapping through the winter resources in terms of couch surfing or extended family or friends or however they define their network to get shelter. And that's just the reality. It's often time for holidays. It's a little easier for them to use those resources. I think that said, that's where the partnerships, the relationships, the connections to additional service providers are really important. Because if young people aren't going to be able to be counted through a shelter or a housing program, knowing the schools, being able to develop relationships there, knowing your alternative education providers, huge. Parks and recreation centers actually for us was a great ally through our study even in March, and is something I would look at pushing in the next year, because young people will go there in the afternoons if they don't necessarily have a place to go that is stable. Because the fact of the matter is you can't go door to door knocking on every apartment or house and trying to track down those young people, but thinking like a young person and working with the youth in your community to understand the places their peers are likely going to congregate during that time is a really strong strategy. And I think ultimately it helped inform where we were sending and deploying our volunteers during our study throughout the community.
Okay, great. And just getting back to that doubled up issue, a lot of people have written in, and particularly when it comes to the school data, how you are separating out youth that are doubled up from when you're reporting to HUD, seeing as HUD does not include the doubled up youth as homeless. Can you speak to strategies for doing that, and also ensuring that the data that you're getting from the schools is accurate in that respect? I think, Tyrone, you might have the best.
I'm actually going to ask Lynne if she can answer that, because again, my Continuum of Care coordinator, who couldn't make the call, would be better to give that answer. I don't want to take a guess on that answer.
Okay.
So could you step in, Lynne, maybe?
Can you repeat the call? I'm sorry, my audio went out and I just got back on. So if you could tell me what the question was.
No, yes, it's in regards to the doubled up population. So when you're collecting information from the schools and other sources where youth are doubled up, how are you verifying that they're not getting included in the reporting to HUD?
That's a really good question, and since we haven't, we're just starting that process right now, and we are just meeting with the schools to looking at the data that they have, and that's part of what we need to figure out is what information, if they're in shelters, are they receiving services, are they getting counted in other ways, and so we're just in the beginning of looking at that process. So I really don't know how that's going to come out right now.
But what I like to commit to is I've written down the question, and I will get the answer, and then we can give it back to you to post to everyone, please.
That would be great. Thank you.
Okay. All right.
Okay, so I only have a couple more questions left, and then I want to give each of our speakers an opportunity to say one last thing. So the next question that we have is that when you're collecting information, and perhaps Lynn, you might have the best sort of venue or an experience from which to answer this. When you get your final information, your final numbers, and you're looking at the data that you have on homeless youth, are you verifying that the numbers that you're seeing, the sort of the characteristics of the youth, the demographics of the youth, are representative of what the community is seeing in terms of homeless youth more broadly? And so this question is really going towards, like, are we actually capturing the scope of youth homelessness in these point-in-time counts, and is it representative of what the community is seeing in terms of youth homelessness on sort of a yearly basis?
Yeah, I think it is in that we also have data on youth that come into our services and what those youth look like and the demographics and different things like that. So we have other kind of data that we can compare this to, and I would say that the data that we're receiving is very consistent with what our experience has been in terms of youth providers and the youth that we're seeing. So, in that respect, it's been really helpful, and I think in particular the whole survey piece is really a good venue for getting a lot of that information and then comparing to what our experience has been. So it has been very consistent.
Okay, great. So one very, very quick question before I open it up to the rest of our panelists. Tyrone, I've gotten several questions about how animal control was used to help facilitate your point-in-time count, and I'm actually curious myself. So
okay, well, the reason we use animal control is because they're used to going to the vast areas like we do the code enforcement, because we have a lot of dirt areas, so that's the whole reason for the animal control. Not necessarily saying looking for the animals, but they step up and they volunteer for these 2 days, and they use their vehicles, and they're able to cover those areas that aren't as dense. So that's the reason why we use animal control.
Okay, great. And so now I'm going to open it up to each of our panelists that we had on today to give them a chance to say one last thing, one last push, if you will. And I want each of our panelists to also touch on one question that I think is really important, in addition to whatever they think is the most important, is how do you get youth representation on the COC level that's not just a rubber stamp? It's a truly integrated youth representation that helps to actually do work on the COC level and make sure that youth are being accurately or adequately included in COC planning and point-in-time planning. So keep that in mind when you answer. And so, Oscar, do you want to jump in? Do you have anything that you'd like to add, or one last message that you want to leave everyone on the call with? Oscar? Oh, maybe we lost Oscar. Okay, Debbie, do you have anything that you would like to leave everyone with? And go right ahead.
The thing that I wanted to say about your question, and it's a great question, is that one of the things that we've been doing, and this is with my Sasha Bruce hat, is developing a group of community organizers. And I think it's it's a wonderful sort of iteration of the positive youth development field, which the runaway and homeless youth field has really developed. And it means that we are essentially rallying some young people in behalf of improving their own communities. And these are young people who can be homeless or certainly have other kinds of issues. But it is around helping them to see how to make a difference in their own community as one way of making a difference in their own lives. So I guess what I would say is I think that there's a lot of places around the country that are also looking at how it is that we engage young people, beyond a rubber stamp. And I think that this kind of way, this model is something that I would urge other people to either connect with, because it might be going on in the community and people might not know that there are youth agencies that are doing this kind of work. So I appreciate having the opportunity to say that. I think the thing I would say in follow-on is that it seems to me that this has been a really fruitful and rich dialogue, and that it speaks to the importance of this point in time and to the importance of getting organized for it. So I really hope that people that are on the call feel as I do, that this has been really useful, and I hope that when there is follow-on, to please feed back to us, each of the agencies or any of us, so that we can continue to develop webinars that are really useful and critical, which I think this one is. So thank you very much, and I hope that people feel that it was useful.
Great. And Samantha, this is Oscar. Can you hear me now? I was trying to unmute from several places.
I can hear you now.
Great, great. Well, I really just want to thank the panelists. I think it was a great discussion. It's a complex charge that we all have for the youth count, and I think my lesson that I took out of it really is a community process of the CoCs, service providers, schools, as many partners as we can bring into the count, including the youth, the better chance we have at getting an accurate count. So there's nothing I can add other than to thank everyone for their hard work in the past and upcoming in 2013 for the youth count.
Okay, great. Lynn, do you want to go ahead and leave everyone with one last message and address some of that youth involvement issues as well?
Yeah, so what I would say is in having gone through this process and looking forward, it's recognizing that there's still a lot more work to be done, and also to recognize that there has been some groundwork laid, and we've gotten better doing it each time we've done it. And so what I'm really looking forward to is adding on to the other components and really engaging the schools and getting the information. I think that's going to be a key piece as we move forward with our count this year. So, and looking forward to the other thing that we've been doing is being able to bring more partners into this and engaging more people in what the count means and how it can be effective and useful in moving things forward. And I would say in terms of engaging the COC and the youth voice there, it's really about drawing the connections and looking at, it's not just a specific population, but how does that all fit in with the continuum of care? And it brings up the issues about, leading to families. If you've got, homeless families and the youth that are involved there, and many of our unaccompanied youth may be homeless because their families are homeless. So it's tying all of the pieces together and recognizing that we aren't just out there solving one individual problem, but we really are working together to solve the problem of homelessness. And that's going to take all of the voices being at the table and having an equal opportunity to speak about the issues.
Okay, great. Thank you so much. Maggie, do you have any final thoughts that you'd like to tack on?
Yeah, I mean, I would echo everything everyone else has said, and I would also add that, the fact of the matter is in any survey study of this type, given this population, we're never going to have that exact perfect count, but you strive for the best that you can and the most information that you can collect. And really being thoughtful and honest with yourself and your community about some of those limitations, that's okay. but having at least a basic baseline data and being able to then articulate, but we know this is likely low, or maybe this portion is a little bit inflated or misrepresentative because is key. And that's really what has led us to be able to increase the capacity here in the district in a big way. Being honest about the data that we have and the opportunities moving ahead has been huge. I would say within integrating youth in a truly meaningful way, it's a challenge and a struggle. These are young people that are facing a lot of complex life situations, and expecting them to be able to come to a meeting or be very frank and direct about their experience is a big ask. But I think where we've experienced the most success, I would echo what Debbie has said, is when we go to the community, when we bring other stakeholders to meet with the youth where they're at physically, and giving them a space to really respond in a meaningful way to what's happening at the policy level or the funding level and provide voice there. And part of that means structuring meetings in an afternoon when you know young people are more available, or in an evening. But it's something we can all get better at, and I would, love to hear if other communities have really found the right key to doing so. And thank you.
Great. Thank you so much, Maggie. Tyrone, do you have any final last thoughts for other communities?
Yes, again, like we all have talked about, really trying to make this as comprehensive and inclusive of a count, because I know our elected officials, they always question the methodology and feeling like we're excluding youth, and we want to make it just as comprehensive as possible. So always planning. So, we're going to have our count on January 24th, 2013. Well, you know what? We're going to be planning for 2015 on January 26th. So it's a constant process, and really trying to think of how innovative, without going too far out of your boundaries, and coming up with just tips and tools to make that happen. So I think that's one of the biggest things I'd like to leave people with, that, don't put yourself in a box when you're looking at the count. Try to be as innovative as possible, but also remaining in the guidelines and the guidance given. And then as far as the engagement of the youth, really looking at, there's youth councils in our community that are established through our recreation centers. They're also established through our faith-based organizations. And so that's where you can get those youth voices, and not where they're just on the topic of homelessness, but dealing with all the things that lead to the youth homelessness, such as if you're in the foster care system, if you are a pregnant parenting teen, if you've been involved with the juvenile justice system, if you are facing, if you're credit deficient in school. So I would say that those are some key areas to look at to engage the youth in the process.
Okay, great. Well, I would like to thank all of our presenters today. You all did a fantastic job, and the amount of knowledge that you have is really fantastic. And I hope that this has been a really informative call for all of the participants. And if you have questions moving forward, please feel free to contact the Alliance. And I believe a number of our other presenters included their contact information as well. You should feel free to contact them with specific questions about their communities. There are additional resources on point in time available on the Alliance's website. That's endhomelessness.org/pages/youth count. You can find it by going to our homepage and clicking on issues and then on youth. And you'll be able to find the youth count, and I believe the San Jose count, as well as some additional and a map of current numbers that we have gotten from point-in-time counts for youth. And we will be continuing as we get closer and closer to this year's point-in-time count to be publishing more resources and doing additional webinars. So look for those in our newsletter. I'd like to take this moment to thank the other co-sponsors of this webinar, the National Network for Youth, the John Burton Foundation, and the DC Alliance for Youth Advocates. The Alliance truly appreciates their great efforts on including youth in point-in-time counts as well, and we look forward to continuing to work with them on this initiative. And with that, we are going to wrap up today's webinar. I'd like to thank all of our participants for joining us again and remind you that a recording of the webinar and the presentation from the webinar will be available online on our website, www.endhomelessness.org, as well as the John Burton Foundation website and the National Network for Youth website. Thank you, and have a great day.
Thank you.
Thank you.
Thank you.